I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered, bringing to you the stories that are out there of people with their own personal health challenges and how to guide them through some sort of resolution. And so, this is an innovative way to actually talk about the things that we do need to talk about because too often we're actually not talking about them at all. So often these podcasts are just promoting a particular product or a service or kind of lecturing you, and you get kind of lost in all the data and the details. Whereas here, which is really unique and super fun, is that one person is going to present with a problem and the other will guide them towards some form of resolution. And so, why are we doing this? Well, for today, with all this overwhelming amount of information about health, it's very confusing. Even I am confused. I mean, I trained for 17 years and been in practice for 25 as a plastic and reconstructive surgeon. Some people might be asking, well, what is he doing this for? Well, I've been dedicated and committed to wellness and health optimization for the last 25 years. And there's a lot more to that, and you can check out my website. But more importantly, is that people are confused. People want the information, and they also don't know who to go to. And so that's the purpose of this podcast, to edify and illustrate amazing individuals like we have on today's show so that you can learn from them. Now, that process by which you need to make better, I mean, it's not need, but can make better decisions in regards to your health, and then reach out to them to get the specific help as well. So how do we do that? Through role playing. One person will have presenting with a problem and the other will guide. And at the end of that, what we'll do is we'll unpack all that information. And so that you can get some insights and specific action steps that you can take. So for today, really excited once again having back on this show Dr. Matthew Ormond and his guest Andrew Eng. So first, Dr. Ormond, please introduce yourself. We'll go with Andrew after that, and then we'll jump into the actual role play.
Beautiful. Thank you again, Dr. Bart. It's such a pleasure to be with you. I so admire this podcast and what you are innovating. And so what a privilege to be a part of it. My name is Dr. Matthew Ormond. I am in Phoenix, Arizona. I have a practice in Huntington Beach, California as well. My background is chiropractic, kinesiology, acupuncture, but I really find myself in this space of holistic medicine, where we look at sometimes very complicated health problems, but we're finding simple solutions. So I've had the privilege of working on 85,000 plus patients in my time, nearly 20 years in practice. And it's my privilege, I did not realize this coming into this profession, but it has been my privilege to understand pain, to become a student of pain, and to help people move through pain to find resolution and find solutions to their lifestyle.
And what I love about what you do, Dr. Orman, is that you embraced everything that's outside of conventional medicine that actually has incredible potential and has results. And you've seen that with the 85,000, patients that you've taken care of the years. You and I have had many conversations in regards to that. And I'm also humbled with, your approach to things because you really truly are helping people in the way that they need the most help. And, once again, I mean, not knocking conventional medicine. I'm a conventional doctor to begin with. There's a place for everything. And my thing that I always like to say is whatever works, works. And you have what works. Andrew, please
Yes,
introduce
sir.
yourself.
Hi. Thank you very much for opening this platform and inviting me here today. My name is Andrew Eng, and I'm a licensed acupuncturist. I've been a healer for over 16 years now. I began in self-healing, healing my own injuries from playing sports like parkour, wrestling, martial arts, tricking, extensive background in movement. And I also have history in deep tissue massage and energy healing. And now I'm in the motivational speaking and online health coach space. And in this world, I help holistic healers learn how to heal themselves because healers need healing too. And to be able to spread that knowledge of self-healing to their family, to their patients, to everybody around, because it's so important that we all are on an upward spiral of health in our pursuit of helping other people.
Well, thanks for committing to that, Andrew, because you're right. Us healers, we need all the help that we can get, and oftentimes we're the last ones to ask for help. But truly, one thing that I think that's key that you're bringing to the table once again is, as we look at all these different modalities that can help optimize our health, it's a matter of stacking everything up. It's never just one drug. In fact, I prefer it not be a drug at all, but these different modalities, and you bring two of them, which are critical. And one is, the structural, the massage part, and the other part is the energetic. And these are two of the components that are so critically important to help people optimize their health. So I'm honored to have you on this podcast as well. So I know that you're going to be presenting with a problem, Andrew, and Dr. Ormond will guide you. Go ahead.
Okay. In this situation, I am a dentist of 15 years. I've had a mild heart episode about 2 weeks ago, and I'd love to learn what's going on and have some help in this because I'm a little scared.
Very good. Very good. Beautiful. So Dr. Andrew, thank you so much for meeting with me and making some time to have this discussion. And that's, my heart goes out to you, truly. Like what a scary circumstance. How are you doing, first of all?
I'm doing all right, I guess. A little shaken up, wondering what's going to happen with my practice and how I can keep things afloat, while also understanding that I really need to take care of my health, or else there's gonna be no practice to take care of.
Truly, truly. And if we can get into the heart of the matter, so to speak, tell me about energy. How are you doing? Are you able to have enough energy to work? Are you not working currently?
Well, I feel low energy and I have things running at the clinic, but in the moment, I'm kind of running on adrenaline, just kind of forcing my way through to handle things. It feels like I have to get things done, but I'm scared that doing it in this way is just making problems worse.
Yeah. And I was pleased to hear that the doctors ruled out any blockages. They ruled out, anything that was pathologic in nature. So you really, had a significant health scare. However, more or less have kind of gone through it unscathed. So
Mhm.
so that is a huge blessing. I'm super grateful, super glad for you. If you look back just through your, doctor's lens, you are an intelligent man with your training. Uh, what caused this, or what has contributed to this condition?
Well, I've been operating on incredibly high amounts of stress for the longest time, just having a full patient load and just feeling like I have to do everything myself. It's kind of hard for me to delegate. It's hard for me to have time to take care of myself. I know I'm supposed to do these things. I recommend these things to people all the time, but it's hard to take my own advice sometimes. And you know, I've seen this happen so many times. I just want to make sure that I can get myself on the right track so that I don't relive the mistakes that I've seen so many other people go through.
Absolutely. I think that's wisdom right there. And it's scary when the first sign of a heart attack, as we have in the Western medical world, is that we have a heart attack. As a holistic doctor, I think there are some more subtle signs. If you're looking back through this lens of hindsight, were there some subtle signs prior to 2 weeks ago that there was something else going on?
Lots of anxiety, some heart palpitations, some issues with sleeping, not being able to sleep at night. And when I would run, I would feel like I'd have some shortness of breath, but it didn't feel like too big of a deal, so I just kept going.
Yeah, yeah, you bet. And if you look at it, what's at stake? Let's say that you're not going to get better. What's at stake for you?
Well, I have an office with 10 employees. I have a family. I have friends. I have so many people that I feel like depend on me and I feel like everything's on my shoulders, and I feel obligated to help others more than I help myself. But this recent episode has helped me realize in order to truly help others, I have to help myself.
Yeah, poof. I hear you, brother. And what heard you say is it's everything is at stake.
Yeah,
So
feels like it.
yeah, and I salute you. And you alluded to this, but your circumstance, your situation is not unique.
Mhm.
I think there's a lot of dentists. I think there's a lot of practitioners, sole providers that are in this same spot. A lot of practitioners. It is. I salute you for being in high service to your patients, for keeping in mind your staff and wanting to support them. It's that's the unique challenge, right? Is if you're not producing, then the office isn't productive. And so there is a requirement for you are the central part of that office. And of course, and what that brings to your family is essential. That is a living, we call it. And so thank you for taking this time to meet with you. If you could set an outcome or two or three, what outcomes would you like to accomplish in this time that we're together?
Outcomes. Well, I'd love to be able to relax a little bit. I feel like I'm just always on go mode all the time.
Yeah.
And as a result, I just feel exhausted at the end of the day. And then in the morning, just have to drink a bunch of coffee, just get the adrenaline going so I can get to work. Also just the chronic pain I have from looking down all the time. I use my hands a lot and I have some pain in my hands and fingers. I'm worried about arthritis creeping in. And my neck pain. I have a lot of older friends who have had to have spinal fusions and neck surgery in order to resolve some problems. And I already feel like some of my discs are bulging a little bit, and I don't want anything to get worse.
Yeah, yeah. Thank you. You have articulated some significant problems, and what's at stake truly is that if these problems aren't handled properly, at very least, you might lose some of the dexterity in your hands. But on the grander scale, yeah, if we don't right the ship, it's practicing dentistry is the least of your worries.
Mm-hmm.
And so I heard stress first. Certainly exhaustion is a piece of that, adrenal driven, and then the chronic pain is piece of this. So if we could help unpack and find resolution and really strategy to the resolution, would that be in service of you?
Yeah, of course. That would be great.
Amazing. And I have about 3 minutes before my next patient, so I want to be concise with this. With energy, what do you do on a daily basis to recoup your own energy?
Well, I guess I'll just come home and watch TV for a little bit. Um, Nothing really. I know that I should do stretching or meditation or go on more walks or go to the gym or something, but I'm just so tired that I really just lay down.
Yeah, and I hear you. And if I can give you some reassurance, here's the doctor's note, the virtual doctor's note is I don't want you exercising right now.
Okay.
I give you freedom from going to the gym to exercise. I think that's the wrong place to go in this moment. Just there's an energy expenditure that is the cost of going to the gym. There's benefit there, but the energy expenditure is too great, and so therefore the exhaustion. We're dealing from exhaustion. That's not the time to introduce a brand new activity, an energy costing activity. And so I think relax was the first thing you said, and I just want to speak to your nervous system for a moment. Because the drive that you have, I feel it, I hear it, you are ambitious, and this drive has driven you through, I have no doubt, driven you through dental school, into practice, and has continued on to this day. And what I'd like to help your nervous system organize here, it's like, because I felt the same thing. That drive got me through chiropractic school in the first few years of practice. However, at some point I could see a dead end, that pushing at this energy at this level was not sustainable, and found a fork in the road opportunity here. And so, to me, setting a figurative finish line is something that's really, really important or has value. And then also a framework. And so here's a framework that I'll share with you, and then I'll pause, and I'd love to hear your response or your
You got 1 minute.
what you hear.
You got a minute.
Thank you. And so what I want to pour into you and look at, there's 7 aspects, and I call them 7 pillars of longevity. And the 7 pillars are physical health, mental and emotional health, familial health, social health, vocational health, financial health, and spiritual health. And spiritual, I'll interchange that word with service. But these are 7 buckets, 7 containers, so to speak, that we can look into. And to me, it creates a 3-dimensional, and possibly, if you're open to it, a 5-dimensional view into your world, into your nervous system. And I guarantee you that you have buckets that are full in one of those 7 areas, at least. And so identifying where there are strengths already, where there's energy already, what's easy for you, then also identifying where there's deficiency, where we can pour into it. And then putting out this structure, a strategy for for your nervous system. And I'll pause there. How does that sound to you, doctor?
That sounds good to me. It feels relieving that I have some help and I'm not just on this alone, and that I've been given permission to relax and to not feel guilty about that I have to push myself even harder. So thank you for that.
Yeah, beautiful, beautiful. I look forward to continuing this conversation. Doctor, it's been great.
Thank you.
Great job, guys. And just give a little context as well. Dr. Ormond is working with a lot of dentists. Andrew has also a lot of experience with this thing. And I really appreciate you actually role playing in the real true form of the show, by the way, which is the first almost, because these are some things that we have not talked about. So absolutely love the fact that you bring this up, because one thing I do know, and in a moment I'll ask you each a question. But what I do know is that in today's economy, especially for practitioners like dentists, like doctors, who are basically trading time for money, it's harder and harder to make ends meet. And so therefore that stress is also magnified, coupled with all the other stresses that these professions bring with them because of all the bureaucracies and insurance issues and all that kind of stuff. So therefore, this is definitely a key issue. And I'm actually grateful that you brought this up. But I'll first ask Dr. Ormond, what was that all about for you?
Thank you. I mean, I see this problem out there. Growing up, this is a near and dear to my heart circumstance. My father is a dentist, and he's now since retired. And while he took real proactive steps to care for his health, I saw his partners in this dental group that he was part of towards the latter part of their careers, true suffering. And I recognized the grind and the stress and what is there. And I wanted to bring solutions. I wanted to see how I can help these people not only provide a tremendous service to their patients and to their practices, but also live a life that is outside that practice where they feel energy and feel fulfilled.
Yeah, and we'll dive in a little deeper into some of the things that you shared. But Andrew, what was that all about for you?
Well, it felt good to be able to express the feeling of what providers feel like, and to have like a voice to be able to express these things, because I feel like so many of us are just holding everything inside, feeling like we have to deal with it. As the healer, we must deal. To heal, we must deal. But the truth of it is that as healers, we must heal.
Yeah, and well said, Andrew, and certainly you're right about that, because oftentimes as healers or practitioners of health, we have this kind of idea that we're infallible, we're indestructible, or we can't have any kind of weakness, but we're just regular people, just like anyone else, with our own limitations and the stresses and everything. And yes, you're both absolutely right. And I think it was Jim Rohn, who originally was talking about helping others first before he helped himself, but realized at some point he's got to help himself first, because then he's in a better position to help everyone else. And that's so much, the case with you healers as well. Andrew, share a little bit more about, Dr. Ormond, share a little bit more about your 7 pillars. And then, back and forth, you between Andrew, whatever you want to share. Go ahead.
Yeah, thank you. You bet. So I've heard this displayed. This is, a lot of what I do is borrowed and it's amalgamated into my own understandings. So this was called the wealth wheel. And I love the framework and what I've been told, and I understand this linguistically, is the TH ending, health, wealth, is a state of. And so wealth really is a state of wellness. Health is a state of healing. And so that's the framework I look at this wealth wheel. And so there are those 7 pillars. And, I've been 2023, I spent that year really delving into the things that cause longevity, how to, maximize longevity, and not just longevity, but optimize lifespan. And so I've come up with various frameworks, but this wheel of wealth, I saw some real ability or power there that I could pour in on each one of those parts of the bucket and help. We could have a terrific financial background. We could have terrific vocational health. We could be physically strong and yet familial health and social health is depleted, and yet we feel tremendous pull and tremendous energy draw that's being taxed by those areas that just haven't been focused on. And so really, wealth and wellness is focusing on all those areas. And I think, for many of us, for our nervous system's sake, putting a framework where, there's no longer a guesswork of, I just don't know why I don't feel well, to like, here's some footholds and here's some handholds. And in fact, here's the opportunity to build a foundation on these concepts. And as I've focused on that myself, and I've used this with patients, we've seen progress, we've seen energy. That really is, we have access to this energy that's beyond our own when we are in alignment. And it's not anyone else's definition of what financial wellness looks like or physical health looks like. It can be our own definition. So we define what those things look like and then move forward. And the nervous system, it wants certainty. So that's what it provides.
Andrew, your thoughts?
Yes. Yeah, I definitely agree. I love foundation. I love the path. I love the wheel, introducing some circular logic as is present in Eastern medicine. I love that this idea of creating a foundation so that people don't have to feel so scared. I've seen so many patients who come in full of fear, and just by explaining some simple concepts and aligning the path, I can just see in the initial intake, I can see their whole spirit, their whole presence just relax. Like, oh, okay, this is where this is coming from. This hasn't just attacked me out of the sky. There are causes of this, and that I have some ownership over this, and I could therefore do something about it. And that all of these issues are not outside of me and outside of my control. So I love that you put a path down, a simple path that has structure, like, okay, there's 7 things here that I need to take track of, versus without that framework, it's an infinite expanse of anything.
Yeah.
I don't know what I need to take track of. And so by having it like this, okay, I should do this, and this aligns me this way. And I have someone to help hold my hand through this process until I can learn how to do it myself. And I think that is very calming to the nervous system. I think that is opens the realm of the future versus being stuck in the present and the past and fear of the future. Instead, like, okay, there's hope. And I think from hopelessness to hope is such a powerful tool that is not to be discounted. I've heard people say before, oh, well, it's just hope. Like, who cares about hope? But to someone who's feeling hopeless, hope is everything. And when you can provide that for them through mental frameworks and through tactical techniques, then it is truly life-changing.
Well, this is quite impressive, both of you, and the reality is that the confused mind is not going to make any decisions, and so people are very confused today. They're overworked, they're overstressed, they're intoxicated with all this nonsense that is in the media, but also the pollution out there, and they just don't know where to go. And part of the challenge is that with absence of wealth, however you want to define it, then there's also absence of wellness in the context of wealthy people have the ability to get access to all these different health optimizing solutions. But the truth of the matter is that we no longer have an excuse to be sick, because there are people like you out there. It is affordable. The information is out there, but you're both talking about something that I think is key, and that is assuming the responsibility, for yourself to optimize you. But clearly, finding people like you, Matthew, and like you, Andrew, is the major differentiator. So what else would you like people to know about what you guys just shared before we wrap it up shortly?
So I've got something that just I'm present to, and this is what brought me into looking in the dentist specifically. But the same course, I've looked at it for chiropractors, and I've looked at it for medical doctors and various practitioners. Is this is a highly educated group of people, and in this highly educated group of people, the standard care is insufficient for them. They recognize that time is money. They're incredibly busy and driven that way. And so when they go and get standard blood work taken, and this kind of the standard procedure is, and this is not denigrating any office, but this is kind of the standard procedure is, we'll call you if there's a problem, is kind of the standard procedure. And after we do that charade for a little while, these highly educated, medically educated people are like, well, what's the point? This is not valuable. And so I want to bring value back into their numbers, value back to their biometrics, and show them. I've never seen, in thousands of blood work that I've done, I've never seen a perfect blood report. And so be able to show them in their numbers, here's some areas that are doing well, here's some areas that we can improve upon, and giving them a roadmap how to improve it. With these, with these patients, they already have the knowledge, they have the understandings, and to speak into them, it's so fun. I don't have to teach the alphabet to them whatsoever. They're already incredibly literate. And so taking their literacy and then exponentiating it and optimizing what they have already. So that's a group where I feel like these are ideal people to serve. And then I'm present to the ripple effect as they feel healthy and they are, looking at all 7 pillars of their life and pouring into each one of those 7. Family life is better, social life is better, but vocationally, the way they're able to serve is better. And then, service is the currency of the universe. So as they're able to serve more, they get more. And so like there's a wholeness, a wellness that comes from this. So that's what has me present to this.
Yeah, and wholeness is a key word because in behavioral psychology we have 7 human needs, which I know both of you are very familiar with. And one is love and connection, another significance. One is certainty, one is variety, and then you have growth and contribution. And it's just how we're wired. And so it doesn't make any sense that a part of our lives are so skewed one way or another. I don't necessarily use the word balance. I prefer the word harmony. When everything's harmonious, and that's every part of us. And that's why I think the work that you both do from totally different dimensions, if you will, but ultimately bringing the whole together in a unified way. With Andrew, obviously, with the body work and then the energy work, and then you, Dr. Ormond, with everything else that you do magically as well. So I think that's super powerful. We have a couple more minutes. Anything else you want to add, Andrew, before we wrap it up?
Yeah, sure. Well, I love this idea that Dr. Orman has helped me understand is to help people who are already highly educated in the fields of healthcare and helping other people. I have extensive experience in helping people of all kinds learn these things from the ground up. But as Dr. Orman helped me understand, what about helping people who already have a huge foundation of knowledge? And so I can speak from a place of jargon and terminology and just use some more advanced concepts right away, and to be able to speed up the process, not only for myself as the coach, but also for the practitioner who is going to be able to glean more value out of these interactions simply because they can understand so much more because they already have the experience. So I think this is a great realm to enter, which is helping practitioners elevate to another level, not solely on greater education on what they're already masterful at, but also greater education and understanding and becoming masterful of the self this way. We're so tuned to be this way outwards, but in order to have harmony in all sectors, we also have to go this way to understand internally. This is core value number 1 of my 4 pillars of infinite energy is expert communication. As practitioners, we already have a degree of expert communication going outwards, but we also must have a degree of expert communication going inwards, understanding the signals of our body. What does that stress mean? What does that shortness of breath mean? What is that chronic pain signifying and telling us? How can we interpret it and then give the body what it wants? We already understand this in terms of being hungry, sleepy, or thirsty. What about pain? What about stress? What about fatigue? And to understand that these are not signals to be ignored just because it's possible to ignore them for decades at a time, but instead to look at them now and put the same amount of effort that we use to put out the fires in our business, to put out the fires in our health, so that we can continue on and be sustainable for the long-term longevity goal, which I love that we are all aligned in this idea of longevity, and the ripple effect of helping practitioners who then will help their patients. And this is really how we can expedite this process of educating the world in self-care and self-healing.
Well said, Andrew. And we're going to use that monologue there as your last words. And how do people find you, Andrew?
They can find me on Instagram at healwithandrew.com. I also have a YouTube channel under the same handle, and I have a free masterclass at backpainmastery.live.
Awesome. And Dr. Ormond, how do people get a hold of you? And then last comment from you.
Yeah, thank you very much. This has been such a pleasure. It's such a pleasure to talk shop with people of high understandings. And so again, thank you for setting this platform up. You can find me a Facebook group called Healing for Healthcare Providers. I have another Facebook group called Vision Quest. It's the program I've written for teenagers, which is a beautiful program. I have a YouTube channel, Dr. Matthew Ormond. And then, of course, dr.matthew.ormond@gmail.com is a great way to get a hold of me.
Great. And what I find, so important, what you both are doing is also educating practitioners out there of all kinds, what else is out there that they may not be familiar with. And exactly as you said it yourself, Matthew, is the standard is that we're delivering isn't exactly the standard that we need for ourselves. There's more to that, and that's always going to be the case. And my vision has always been that who's more qualified than anyone else out there on the planet to be able to guide the consumer with all the different options out there than doctors themselves, because they've got that high level of education. But guess what? They don't have the expertise and the magic hands of people like Andrew. And so we all need to work together, collaborate. And what I love, what you just shared, Andrew, as well, is what you're also doing. You're educating these docs out there, what's possible, which in turn should lead to them sending more people to you because of what it is that you can do for them. But ultimately, what I believe is that, there's so many answers out there. There's no single, answer for anything. We just need to stack it all up, whether it's conventional medicine, whether it's outside of conventional medicine, in a unified fashion, all working together, whether it's acupuncturists, nutritionists, chiropractors, or neurosurgeons. I don't care, right? We need to work together because we're at a crisis now with so many people being sick and no end in sight. So this is why we have this podcast, and this is why I love the fact that you guys are sharing your wisdom and your magic. And my hope is that people leave with some insights today, especially your dentists, colleagues out there, not colleagues, but people that you're reaching out to, and reach out to you, because we all need your help. So both of you, Matthew, Andrew, thank you so much. And I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And hopefully you're leaving with some sort of insight and action step that you can take towards optimizing your health. And we will be back.